Okay, so good morning, everybody. Welcome to today's Journal Club. Today I have the following paper for you with the title Craniomaxillofacial Trauma in Immature Dogs, Ethology, Treatment and Outcomes. We're gonna go through this paper today, and I would like to start with a small introduction. So basically, we know that craniomaxillofacial traumas are a relatively common thing, especially on emergency basis. But if we look at treatment modalities, outcomes, basically good data around this topic, and then especially in young dogs, we will find that there's limited data out there. It is also a controversial subject. It kind of depends on which kind of surgeon treats those animals, what they prefer. So we're going to look at things like this. And so the primary objective of the study was, or they were trying to describe, first of all, give us some data about these cases. So what are the common fracture locations? What are different treatment modalities and outcomes? What are typical complications and how common are they? And what influences our fracture healing? On the picture below, you will see two images of two so-called non-invasive techniques. One is the nylon muzzle applied to this dog. It's especially useful for caudal mandibular or temporomandibular joint fractures. So basically those kind of fractures where it's hard to access and hard to do anything else. On the right image, we will see another non-invasive technique, like they call it a face mask. This is useful for all sort of maxillary fractures, and then you will see some other images later. So the author of this study is a resident from the Davis University, which is kind of a well-known study or university, and they publish quite a lot of studies. And so the hypothesis of this whole study was that the immature dog has an increased risk of healing complications, and this is also influenced by the type of fracture, the location, and the treatment modality. But no matter also the dog, so they're saying the dogs are having an increased risk of healing complications, but still, because it's young animals and they have a good innate bone healing capacity, they're secondly hypothesizing that these dogs will heal quite good, despite having some factors for complications. So the evidence around this paper, so as I was already mentioning in the beginning, craniomaxillofacial traumas or fractures are common in dogs, and they're more common when it comes to small and juvenile dogs. It's kind of historically that we would manage those patients based on with a minimalist approach. This also comes from the human side, where it was mostly, or it was believed that closed reduction and maxillomandibular fixation, so basically those non or minimal invasive techniques, are the treatment method of choice for displaced facial fractures, especially in young patients, because we are afraid that it will interfere with the growth and development of our facial skeleton, and we don't want to put too much into, or we don't want to put anything in the tooth butts, for example, or in a face which is still growing. This is shifting nowadays, at least in the human sides. I mean, it is mostly partly, or the reason for this is that the techniques are developing, also the materials, the implants, the plates are getting better, especially titanium plates are becoming more commonly used. And then we could talk about open reduction and internal fixation. And this is nowadays considered gold standard in human medicine, but it's still kind of a controversial topic and will still kind of depend on who and the special case and what your options are. But this is changing a little bit. But yeah, it's just interesting that it's how things can change, but still both options are or can be considered good if the patient is appropriate for this. And due to the complex anatomy and overlapping nature of this field, so basically the head itself, it's known that the CT has some greater diagnostic yield compared to conventional skull radiographs, and this is why we should, and we will also see why that we should look, or if we use imaging, we should use CT over radiographs. And this is on the picture below. We will see an example of one open reduction and internal fixation, where we have this displaced fractures in the midline of the skull, and they open it, they put those plates in, and you can see also follow-up pictures and see how nicely it healed. But then on the other hand, they also show the case where we have a caudal mandibular fracture, where they only applied muscle therapy as a treatment, and you can see this is only few weeks, I it was 4 weeks or something, a few weeks later, you can see it's completely healed. So both options work well for this case, and you can see how different the cases are. The study design, it's a retrospective study. I think I already mentioned it. We will see that later. And if we look at the methods, so what they did, they looked at 94 dogs under the year 1. They looked at the CT or cone beam CT images and the medical records, and then they basically gave us all the data they found in there. So if we look at the results of this study, I tried to summarize. I will have some graphs later on, and they're quite easy to read. So if somebody wants some more data, you can easily find it. So the majority of trauma was caused by animal bites, and I think that makes sense. It's a typical thing in young animals that they're getting bitten, and so this was the majority cause of trauma, so 71%. The most likely bone region to be involved was the maxillary bones. We will see a nice heat map later on where you can see all the different regions and how commonly they were fractured. And the second most common was the molar region of the mandible. So you will see they also split different bone segments into different regions. You will see that. Then the average number of fractured bones was 8.8, but also so quite a lot of fractures per animal. What was also interesting that there was some connection, or it was associated when we had rostral mandibular trauma, that we would also find intra-articular fractures of the temporomandibular joint. So if we see a fracture in the front region, we can suspect, or at least it's not that rare that we will also find temporomandibular joint problems or intra-articular fractures. We would also find, or they would also find patients with concomitant injuries in 32% of the cases. So also a lot of additional things going on. What was interesting as well was that the most commonly performed treatment they did in those young animals was muscle therapy. So in over half of those patients, so 53%, they just applied the muscle to begin with to stabilize the thing. And and we will talk about this maybe a bit more detail about the different results, but they also saw healing complications in a lot of cases and 71% of dogs, where malocclusion was the most commonly reported with 55%. There were, let's maybe talk about this a little bit more. So with healing complications, they were looking at you will see the list, non-vital teeth and so on. But it's so they had a lot of complications, but the complications were minor one. We shouldn't forget about them, but it wasn't like massive problems. We could usually treat that as well quite easily, and it kind of fits the hypothesis in the beginning that they were thinking, even though we will have some complications due to the nature of young dogs, we will still most likely see good results, and this is basically what they saw. So the number of complications per dog was 2.4. So as I mentioned, there were some problems usually associated with the teeth. And yeah, I don't know if I have all the pictures included, but they were kind of hard to themselves when it comes to complications. They couldn't find any statistically significant association between the treatment modality and the healing outcome. In the discussion, they are mentioning it's still, we can't say that every treatment is good for every patient. We still should decide what is possible and what is the best for each individual patient. But as you can see, they couldn't find much better results for example, rigid fixation or anything. And this is also what I kind of suspected to be, there was a positive correlation between the severity of fracture and displacement with a negative healing outcome. So the more messed up the head was, the worse the healing was, basically. So with all of this, I think most of this is makes sense, and I think it's not that hard to believe that those numbers could be actually kind of true. You will see. So they also give us some other demographic data about the sex, dentition status, skull type, and so on. This is what we already saw here. You can see the other types of trauma. So we saw that it's the cause was mostly animal bites, and the most concomitant trauma was ophthalmologic one. You would see the others as well. This is the heat map I was referring to. So here you can see all the different types of bones which were involved and how commonly they were involved. And in the discussion, they're also mentioning why they suspect maxillary and mandibular molar region to be overrepresented, because they are prone. It's like the bone which kind of sticks out. When the molar region, it has something to do with the shape of the teeth. So it kind of makes sense if you look at the basically physics, how those accidents happen, that those bones will most likely be fractured. And then we see again treatment modalities and all the types of complication. As I said, if someone is interested, I would just recommend having a brief look at this. And lastly, if we look at the limitations, so it's in retrospective study design, so there are always those limitations which will come to that. They were not having follow-up examination and repeated imaging on all of the cases, which would be, of course, the best. And they're also mentioning that it's an institute where they have mostly referred cases, or I think mostly referred cases, and therefore they probably see a special type of cases. So probably they won't really see the most or really minor displaced fractures, maybe they will not see them, so they're not included in this population. But yeah, except that I think it was quite nicely done and very easy to understand. Okay, I hope everything worked. I hope you could hear me. All right, then have a nice day, have a nice week. See you next time. Bye bye.